morning. Thank you all for staying till the end of the talk. I'm excited to round out the talks with a look at eye tracking in pharmacy research and how it can be applied to your work in healthcare as well. I'll begin with a general introduction to eye tracking. All of the three studies in this presentation used Tobii Pro eye tracking technology, and these glasses, as pictured, fit like a standard pair of glasses, which makes them an unobtrusive and reliable measure of what a participant is looking at and for how long they've been gazing in one spot. Our brains are so good at taking in visual stimuli that when we're exposed to a visual scene, we think we see everything all at once. But in reality, we're exposed to a much smaller part of our visual field. Here's an illustration of this. The area of focus is sharp and refined, but the peripheral area has limited detail. And by measuring eye tracking movement and fixations, we can draw conclusions about the subconscious cognitive processes that are occurring in a participant that they may not articulate to a researcher in an interview alone. Eye tracking is a versatile data collection tool for assessing user behavior, and in this presentation, I'll be sharing how this methodology can be applied in a macro setting, a near-life simulation, and an assessment of dynamic stimuli. The first use case is eye tracking in a natural setting. When conducting this study, we asked the question, what do patients look at when navigating a healthcare setting? And this case involved having patients complete an assigned task in a real pharmacy environment to examine how our intervention and the physical pharmacy layout influence their behavior. To assess gaze data from a natural setting, areas of interest are drawn onto the actual photos of shelves the patients interacted with. And AOIs are visualized as the colored rectangles on the image. So these get manually drawn on, and they aggregate every instance of gaze fixation onto an object within their borders. And from there, we can aggregate the total amount of time someone looked in there or the total amount of duration of which they're looking. The second case is eye tracking in a near-life simulation. And when conducting the near-life simulation, we asked the research question, how do healthcare professionals use a novel electronic health record functionality? In this case, prescribers interacted with a mock EHR and a standardized patient during a simulated medication review appointment. And eye tracking allowed for natural observation of how prescribers search for information and integrate the new functionality into their typical workflow. Since EHRs are visually redundant, rather than mapping AOIs directly onto screenshots, a schematic diagram was developed. For successful eye tracking, AOIs must be visually distinct from one another and large enough for a margin of error. So having this schematic diagram was able to accommodate different requirements and represent key elements of both the intervention and the EHR. In this type of scenario, eye tracking was helpful for assessing the subconscious habitual processes that a doctor may engage in daily in the EHR, but not think to share with someone in a talk aloud. And the third case is eye tracking of dynamic stimuli. For this study, we asked the question, what do older adults look at in a drug advertisement? The study examined which components of a medication advertisement are most visually salient to the older adults. And it differs from the previous two because the participant was stagnant and the AOIs, which was the video, were in motion. Participants were instructed to watch the advertisement as normal, and the eye tracking glasses captured their behavior throughout the entire minute of fast-paced stimuli. Since the AOIs were in motion, we used something called dynamic AOIs, and on the screen is an example of this. Since it's in motion, the AOIs are drawn similar to a flipbook, where the AOI boundaries get manually drawn around the visual element the first time it appears, and then altered frame by frame throughout the duration of the video. Eye tracking results can be presented through a variety of variable measures, making it a diverse tool to convey powerful results to different audiences. And results are most commonly presented as an aggregate of the total number of fixations or total gaze duration within an AOI category. Numerically, we might see this presented in a table in a manuscript, or visually, we can present this via a heat map or a gaze order plot. Thank you all for your attention this morning. I'd be more than happy to answer any questions. And if you have questions about the second study, the electronic health record study, Dr. Kleinschmidt has a poster later, and you can scan the QR code to access a website by Dr. Taylor Watterson, the PI for that project.